Good morning, guys. Dr. Katie here, coming to you from the clinic space. And I just am going to talk a little bit today about neck pain and some quick solutions that help often with neck pain for patients. So it's something that I have recently made a couple of posts about, and I've had 3 patients this week that I've been working with on neck pain. I think that with the stress of everything we have going on this week and just continuation of potential workspace changes, perhaps not being the most ergonomic, a lot of us are having additional neck, jaw, headache symptoms. So I'm just gonna point to 3 things that you guys can do right now to help alleviate some of these things. So number 1, I talked in my last video about posture, and so that's something that this is gonna kind of tie in with. So certainly a lot of times, and I'm gonna kind of turn to the side to show you, but we tend to have a forward head position and a rounded shoulder position. So again, just being mindful to bring the shoulders back and down, bring the head up a little bit so that you're not looking down at what you're looking at, say a cell phone or a computer. So keeping that in mind, while in this position, I want to educate you guys to something called diaphragmatic breathing, which is essentially using our diaphragm and using our breathing muscles to breathe versus doing shallow chest breathing, which uses our neck muscles and can lend to more tension. So placing one hand on your chest, one hand on your belly, with your shoulders down and relaxed. Take a deep breath in through your nose and make your belly hand move and not your chest hand. And exhale through your mouth and relax. So the idea is that when we are doing these shallow chest breaths, that we do a little bit more of that. And so muscles that might already have some tension are going to now work themselves even more. This can also be done lying down flat on the floor, in your bed, and it honestly just helps a lot of tension to kind of reduce out through your body. So I encourage my patients to try to just find a quiet space, find a quiet moment in your day, and try to practice that breathing pattern for, even if it's just 2 minutes a day, that really will help a lot with working on your breathing mechanics. So number 2 is just a really basic stretch for what's called our upper trapezius muscle, which a lot of us are familiar with, our upper traps. So I have seen this done incorrectly a lot of times. So what you want to do is bring your shoulders back and down and tilt ear to shoulder on one side until you feel a stretch anywhere from just behind your ear all the way out to your shoulder. So common mistake a lot of people will make, they do this when you are going to one side. You don't want to elevate your shoulders, you want to keep them both down and back, and you want to hold this position for about 20 seconds and then come back into the center, repeat it on the other side. And then you can go back and forth on each side about 3 times, so you get approximately a minute of stretching in each of the right and the left upper trap muscle groups. And then finally is a stretch for a little muscle group called the scalenes, and those are actually on the side and the front of our neck. So you're gonna go into the position you just did for your upper trap stretch, ear to shoulder, okay? Then you're gonna take your chin and lift it upwards toward the ceiling. If you want to apply a little pressure, right here is our collarbone, so just kind of hold that collarbone down, and you're going to feel that stretching more again on the side of the neck and a little bit into the front of the neck. This is a muscle that gets irritated again when we are kind of looking down. We might have our head protruded forward. So the more that we can kind of stretch that muscle, it's going to just allow us to come a little bit more into a neutral posturing bend position. So all of these things are again helpful, and just some of the ways that I work with my patients on neck pain. So like or comment, tag someone if you know someone that has neck pain. I'm happy to chat with you guys about about individual questions. And again, we're doing free phone consultations, so give us a call if you have any specific concerns or neck or headache pain is putting a wrench in your day. Have a great day, guys. Bye-bye.